Acromegaly essentially is a pituitary tumor that makes too much growth hormone. So the pituitary gland is at the bottom of the brain. It's a small gland about the size of the tip of your finger, and it's responsible for controlling a lot of hormones in your body, particularly cortisol, thyroid hormones. In women, a lot of the hormones for pregnancy, and in men, some of the sexual-related hormones, but also growth hormone. And growth hormone is something that's essential for normal growth, particularly during when you're young or during adolescence. But particularly as you get older, if you make too much growth hormone, then you can run into some problems. And there is a very small percentage of pituitary tumors, they're called pituitary adenomas. Pituitary adenomas are fairly common, but most of them don't cause any problems. There's only a very small percentage of them that make too much growth hormone. And when that happens, then you get all of the side effects of excess growth hormone. That means you can get high blood pressure, diabetes, your jaw becomes enlarged, you get a carpal tunnel syndrome where you get numbness in your fingers, you can get joint pain, you have problems with very loud snoring and sleep apnea. The excess sweating, there are a number of different problems that arise from that. Nobody really knows for sure why pituitary tumors form. Same way we really don't know why any tumors form. Most of the time you're just born with something that you're born with gives you a propensity for forming these tumors. In the same way your genetics determines things like your hair color or different facial features. The same genes are somehow programmed to make it more likely that your pituitary gland forms a tumor. So there's no real rationale for it, at least as far as we can tell. It's done with a blood test where you measure the level of growth hormone in your blood. If it's high, then it points you to the fact that you probably have a pituitary tumor. Growth hormone causes the release of something called IGF, and so it's the IGF levels that you can also measure in the blood, and they're actually a little bit more sensitive to whether or not you have acromegaly. But whether or not to do that blood test comes from somebody being suspicious that they have acromegaly, and that can be when you go to a doctor with any of the different complaints that you have from acromegaly. So if your tumor is growing and the mass is pushing on your optic nerves in your head, then you can start to lose vision. So sometimes an eye doctor will pick it up. If you're having joint pain and you see a rheumatologist, they may pick up that you have acromegaly. If you're complaining that your jaw is enlarging and your teeth are shifting, sometimes a dentist will notice. If you have a carpal tunnel syndrome and getting numbness and tingling in your hands, sometimes an orthopedic surgeon will pick that up. People who have sleep disorders, they go to a sleep specialist, will sometimes pick that up. So it's more or less when one of your symptoms causes you to see a doctor and the doctor is savvy enough to determine that that's what the cause of it is. Well, growth hormone-producing tumors that's what acromegaly is. So the treatment for it, the best treatment for it is an operation to remove the tumor. And if you can remove the tumor completely, then the patient is cured. That's the best. That's the best outcome. And so surgery is usually the first line of treatment. If the tumor can't be completely removed, or if the tumor grows back after it's been removed, then you have to consider other treatments. And those other treatments are either different forms of radiation, such as radiosurgery or standard radiation. And then there's a variety of medications that can be useful as well. But the first thing is usually the surgery, and if that's not effective, then you have to consider radiation or medical drug treatment. if the tumor's not completely removed and you still have high levels of growth hormone, then over time you're likely to get heart disease and diabetes, and that's ultimately what may shorten your lifespan. You know, it takes years for that to develop, but it's over time it continues to do damage. The side effects of radiation can be that radiation can actually affect your normal pituitary gland, so your pituitary gland may not work very well after that. Then you need to take hormone replacement. And in some cases, the radiation can damage your vision as well. So there are a number of potential side effects from radiation. Well, the problem with the medication, there are a couple of problems with the medication. One is that normally it has to be done with an injection, so you have to give yourself a needle. Some drugs need to be given every day, some can be given once a month, and they can also have side effects. Some of them can affect your liver, they can give you nausea, and the other thing is you usually have to take it for the rest of your life. And in some cases it's expensive too, so there are a lot of potential side effects and downsides to the medical treatment. Well, I'm not aware of any way you could actually prevent this because it's a fairly rare disease, so it's not something that you would easily screen for because, 99.9999% of people don't have acromegaly, so it's hard to do a screening. The best thing you can hope for is that doctors are trained to recognize some of the symptoms so that they would, proceed with testing earlier. I'm not sure that the average person can, appreciate the different aspects of acromegaly and recognize it immediately. But I think it mostly has to do with the kind of symptoms that you're having. Obviously, if you're losing vision, you need to see a doctor. If your feet are getting too big, or if you're developing joint pain, or diabetes, high blood pressure, obviously all of those things are going to need to be monitored by a physician who hopefully will then pick those other things up.